I've had a long-standing interest in innovation, not only contemporaneously in the work that we do here in our organization, but historically, in terms of the people in history that have really thought differently and have changed the world because of their ability to think differently. So innovation for me has always kind of represented the front edge of human creativity, what we have potential to achieve. And when you look around the world, all the things that have made life easier in some ways, made it more exciting, and enhanced the overall quality of life came through innovation. Some big innovations, and sometimes just small innovations that cumulatively have a big impact on the human condition. And so innovation for me is a way in which organizations can continue to move themselves forward, can continue to create new services, new products, add value to people. For Exeter, my interest in continuing to support innovation here stems from that historical view of innovation and my interest there, and the context of understanding that innovation really is at the leading edge of human creativity, and it really at the leading edge of human potential. And we deliver healthcare as an organization, and we are one of our primary objectives is to preserve human potential in terms of the potential negative effects that disease can have on it. And so if you think about innovation as a way in which we can propel human potential, it seems like innovation should be a great way to also protect human potential in the face of disease. So we in this organization see it as a way of reinvigorating our organization. As I said, continuing to think about the way we can improve our lives and the lives of our patients. And it's also an exciting way to approach life, is to think innovatively, to try to be innovative.
So when we think about innovation here at Exeter Health Resources, and we think about growth, and we think about, as the things I mentioned earlier, sustainability and competitiveness, and you think about people in our organization coming up with ideas, as I talked about this morning, to impact change. Where do you think, what are some examples of some things that you think people could be thinking about in terms of innovating?
I think in a lot of ways, innovation becomes more accessible when we think about our abilities to make changes in our immediate environment. And I know in the early stages of our pursuit of the innovation recognition in our organization, we had several nurses who made significant innovations. They weren't life-altering innovations, but they had profound impact on the way the unit worked or the way a care process worked. And so when I think about innovation and its accessibility to anyone, if you think about the space that immediately you occupy, and you start to think about what could I do differently here that would improve my workflow, improve the experience of a patient, improve the experience of a colleague. It is, I think, sometimes extraordinarily difficult to pull yourself out of the daily routine. It's just you punch in your clock, you come in, you've got a million things that you're trying to do, patients here or business processes here, and you're sitting here listening to me saying, well, why don't you just kind of think about how you could innovate around there? And a lot of people are thinking, I'm just holding on for the day. How can I think about innovation? And I would suggest that if you just even think a little bit differently about your work environment, and that is the path, that's one of the first steps to innovation. And we all think about our work environment. We may get angry about the work environment. We may get frustrated about the work environment. So we're not going through like automatons. We're thinking about that work environment. If we could make that next step to ask ourselves the question, what could we do differently? So I do think, the notion of innovation is reserved for this rarefied group of people in the world who are just brilliant and see things so radically different that they're beyond comprehension. That's actually not true at all. And I do think that any one of us, any one individual has the potential to change their immediate environment, to make it more meaningful, to make it maybe more efficient, to make it different for the patient, to just all of a sudden change a direction of a process for the better of the work environment that you're in. That's innovation. It really is.